All right, welcome back. We're shifting gears a bit here, doing a medical show that I think is important to all. At one time or another, we're all going to have maybe some hearing issues. I don't know if you had earaches at times or if you had hearing loss now. You see on the screen here, MorningLine sponsored by Middle Tennessee Audiology. This segment is with Dr. Noreen Gibbons. Good morning to you.
Good morning to you.
She is a doctor of audiology, which means you study sound and hearing, right?
Correct, yes.
It's nice to have you on again. You know, we were talking, she's busy. She's got a practice, and she's a businesswoman that runs a successful practice there in Hendersonville. On top of that, you take time to educate yourself. It's constantly changing. Now, you just said the city of Nashville hosted the annual
American Academy of Audiology.
This is the biggie.
This
all
is
the audiologists from around the country.
Yes, I warned all my patients if they were walking down the street and their hearing aids weren't inserted quite right, someone would come up and push their hearing aid in their ear or maybe ask them questions. Yeah.
That's awesome. So it was at the Music City Center, and 5,000 of them from around the country gathered here. These types of conferences, you know, for whatever practice or field you're in, usually deal with the cutting edge stuff, some of the seminars, and then a lot of the technology that's there. 3 days. What just we'll get into specifics here for things that people. But what did you observe, or what do you want to share that you came away with there? That's exciting.
Boy, there's so much. There's a lot of treatments available for tinnitus.
Again, what is that? That's
talk
the
about
ringing
in the ears. That's not from an external source. So there's a lot of better ways of evaluating it, kind of separating out who's a candidate for further treatment. That's really interesting to delve into when we can make a difference and when we can't, and when to refer on for additional help. It's a big problem for many people. It's actually just as common as hearing loss in some populations, certainly anyone with noise exposure, whether it be industrial or firearms or music.
So you see a lot of patients with that?
We do, yes, we do.
So new developments coming down the pike on that. Are they medicines? Are they hearing aids? Are they treatments?
There's still a lot of treatments that are not medicine. It's very hard to treat it medically because if it doesn't have some sort of medical reasoning behind it, then you have to manage it. It's like pain management. You have to manage it, but you're not managing with pain medicine or tinnitus medicine. There's different things available like masking devices. There's tinnitus pillows for people who are especially bothered at night.
How does that work? Is it a pillow that has sound in it or something?
It's a speaker that is so embedded in the pillow.
What
it's
a good idea.
Cool. Yeah, it is. It is.
So it's masking sometimes.
It's masking or putting a different sound in, or desensitizing people to different sounds. Those are the things that we know are very helpful with tinnitus, because we can't just give some sort of medicine or treatment for it to eliminate it. We know that it's a management issue.
Okay.
So.
Now I know many of our viewers, and we've got some calls coming in. We'll get to those in a moment, but for the top of the list for a lot of us, I think, is when you need a hearing aid and what's the technology. And I've done some research because I have no doubt the time's coming in not too distant future. I'm going to need some kind of hearing assistance. My hearing's just not the best, and so I've researched it, and there are some very, very expensive hearing aids. There are some that are a little more affordable. There are some that I've heard are just fantastic. First of all, do you think the general cost of some hearing aids, the really good ones, are going to start coming down, or are they always going to be real expensive?
Well, I think one thing it's important to remember is when you're getting a set of hearing aids, you want to also be getting services that go along with that. Whether that's bundled in the price initially or not is a very good question. Most often it's bundled in. So if you're purchasing from someone, you want to make sure they have a clinic that's available to you 6 months later when that device isn't working well, or if you need additional testing or additional services. It's not a one-time purchase. It's not a one-time product.
That makes sense. Now what we should say is, I suppose people can go online and order some hearing aid and just get it and fart around with it themselves, and it may work just fine. Now, that'll be one cost. But if you go to a professional like yourself, the cost may be a little more when you buy a bundle. But the idea there then is that you will tailor the type of hearing aid that works best, set it up, and be there if for some reason I need adjustments or a reevaluation.
Correct. That part is the if.
That makes sense.
Then I'll also say when, because hearing aids do break down. Humidity, moisture, wax, dry skin, all sorts of things. So it's important to have a good warranty.
I was going to say, do they come with some warranty? I understand if you hit it with a hammer yourself, it's probably on you. But if hearing aids with wear and tear, I mean, do they last a long enough time, or do you have to pay to always fix them?
Usually they come with about a 3-year warranty, so they'll be covered for all of those things I described, and if you do smash it with a hammer, there's usually a one-time loss and damage, so you don't want to do that more than one time.
Yeah.
But they're pretty durable devices. It's the environment, again, that's the problem. It's Nashville heat, humidity, sweating. Even in the cold, though, you can run into those problems, so that you do want to make sure that you're looking at that warranty, and also if that place you're purchasing it from has loaners available, because I know people think they can go all these years without doing something about a hearing loss. Then they do get hearing aids, they start wearing them. If they need repair, people are pretty frantic to get in and get those repaired, which to me is a good thing. It means that the device is working like we want them to, and they've adapted to it, so we need to have loaners available.
Okay, and I want to get to Ann's call, but real quick, can you answer this for me? Because my thing, if I came to you, and I certainly might, is there a way that I can sample some of the loaners for a day or two to see which one works best for me, as opposed to just buying one flat out and maybe that's not the perfect fit?
It is important to be able to do that, absolutely.
I think that's crucial. I love the fact you guys do that.
Yeah, we have demo devices
so we can
available.
try different ones. There may be 3 or 4 that you would say, Nick, any one of these is great, but one of them you might like better than the other.
That's exactly what, yes, we try to always tailor it for that person, their lifestyle, their individual. We can even do data logging in the hearing aids to see the different environments some people go into. We're not recording anything permanently, but if you're in a real noisy environment, we want to know that. If it's mostly speech, if it's mostly music, if it's mostly transportation noise, we want to know what you are doing each day so that we can make sure that that hearing aid, that set of hearing aids, I say hearing aid, but we are almost always fitting two, is reacting according to your needs. That's really important.
Let's take Ann real quick. I've got so many questions for you myself, but Ann, good morning.
Good morning. I have a grandson just over 3 years old whose mother had speech problems, serious ones as a child, who was very in tune to her child last summer when the allergy season came up and was a little speech delayed. This year she noticed it again, and he has hearing loss and has just been diagnosed with the hearing loss, and it has affected his speech. She's very in tune to this little guy. What, as a grandparent, it's somewhat allergy related, it's somewhat fluid. In the last month, they have had to treat him with antibiotics, and he's a happy little guy now because he's sleeping at night because the fluid's cleared up. But now that he's feeling better, you can absolutely tell that there's a little difference in his hearing. The speech, you can pick up on the words that he isn't pronunciating correctly. His mother was tormented as a child with cleft palate that was undiagnosed and didn't get repaired, and she's really in tune to people that say, I don't understand you, repeat that.
Sure.
Can't take a child out for a hearing loss to help them with, it's not like a motor ill delay.
So you're wondering just what maybe can be done to help him?
Yeah, what as an aunt or a cousin or a grandparent can we do to help a child with a hearing delay?
Sure, Ann, good question.
That is a good question, and I'm glad he has been diagnosed. You know, we always want to get that diagnosis as soon as possible. Has he seen a speech pathologist, a speech therapist with the school system or in a hospital setting?
He will be in pre-K this year, and he will start. The process, like I said, just got diagnosed, so it will fall into it. And so, yes, he will begin to start speech therapy probably at the beginning of the school year.
Good, okay, because that will be really important to help improve his confidence. There's an organization called AG Bell, and it is an organization for families children with hearing loss, well, anyone with any hearing difficulty, they're a great resource for you, as well as the American Speech and Hearing Association. They've got a lot of tips on their website for families, helping children with speech and language problems. I'm going to refer you to those organizations while you're waiting for the speech therapy and the more professional, one-on-one services to kick in. Those are really important.
And little children like that, it sounds to me she thinks the child wasn't necessarily born with a defective hearing, but maybe allergies, fluid buildup, earaches.
Correct,
little kids it's rampant.
Yep.
Knock on wood, my son and I never had it. Little child with an earaches are the worst. I mean,
Yep.
the two things that I can't stand, and there's all kinds of illnesses. Earache, toothache. It's chronic, it's there until it gets fixed, and it affects everything.
Yes.
Horrible. Poor little kid with an earache, I hate that.
Absolutely. The earache, and then also the middle ear fluid comes and goes. It can look like a behavioral problem. There's a lot of behaviors that a child with ADHD will have that's similar to a child with mild chronic, not necessarily mild, because mild is not the appropriate term. It can be a real significant problem, but it can look like a behavioral problem when it's in fact a hearing related issue, and seems to be hard to catch. That's why so many children do wind up with the PE tubes, the pressure equalizing tubes, so that it doesn't become this fluctuating hearing loss that's creating that problem.
Okay, but it can be treated.
It can be treated.
There are some children that are born with whatever, maybe the ear hasn't developed properly or what.
Yes.
Yeah, I know some children for some kind of defect can be born deaf.
Yes.
That happens. But what are the things that you can sometimes see in younger individuals, like what she described, in terms of affecting hearing?
You mean the behaviors that you might see?
No, the causes.
Oh, the causes.
We hit on the allergies, the infections. Can you sometimes look and see that there's a genetic thing where maybe something didn't develop properly?
Yes, absolutely. In fact, universal hearing screening in newborns is designed to catch not only a hearing loss identified at birth, or identified if it's there, but identify risk factors that will keep a child in a hearing evaluation program for the first 3 years of life.
They check it right at childbirth. I can remember with my son, I was there, and he's just born, he's crying kind of, he's looking this way, and they're putting their hand there and they're snapping their fingers to see if he turns. They're checking, they check all the basic senses, I guess, right?
They do, and now we do more formal testing that is done with infants, screening for hearing loss, but usually an audiologist is overseeing the chart reviews and saying, okay, this child's at risk later on, because a hearing test is only a snapshot in time. And we know, for example, with this child, if his mom had hearing-related issues, and the cleft palate is a concern as well, Down syndrome is a big risk factor for middle ear problems. We know that children who unfortunately are around smoking are more likely. That secondhand smoke is a big issue. The eustachian tube is not fully developed, and it's more horizontal in children. As we get older, there's more of a vertical plane to it, but it's the problem of getting that drainage from the middle ear out the right direction, and the eustachian tube's responsible for equalizing the pressure. So if that isn't working right because of allergies or colds, that's where you develop the problem.
Hearing you talk about that, also the ear, you think ear and all these other, how crucial this is with the inner ear and your balance. Oh my gosh, vertigo and stuff like that. Your inner ear goes, those are extreme. We'll talk more about that. That's more extreme, but boy, let's take a break. When we come back, we've got the lines open. It's a shorter segment because remember we started first with some news, but the number 737-7587. 2 more segments to go with the good doctor here. We'll take your calls about hearing loss and hearing aids, and I've got some questions for you as well right after this.
The storm